happy to receive you in Monaco because it's my my town where I live, and so we have always the sun, as you see. And today I would like to present me first. I am plastic surgeon, MD, PhD in Boston. I work a lot of time in United States with Dr. May in Boston and also with Nicanor Isse in Los Angeles. And that's the reason why now I used the thread, because I have a lot of practice of the facelift. And of course, I involved the technical procedure. And now I use a lot in complementary procedure with the surgical technique procedure. So often we saw alone, especially for the neck. We created a special thread to cut the platysma cord. And it's very important because you can use, you can do a lot facelift. Always you have a recidive, you have again a operation of the cord of the platysma. And always you have a recommendation of the patient at 6 months or 1 year. And that's the reason why with Monsieur Malin, we have developed a special thread to cut the platysma cord and adjust the technique with the spring thread. So I would like to resume my thought about the facelift. I created a long time ago for locate for place of the face with the forehead, the lateral place, and the neck. It's my division of the face. And today I would like to treat only the neck because to speak about everything it will be a long time. Everybody know how we can be elder. It's not very important with the alteration of the skin, with the contraction of the muscle and the loss of the fat. It's very interesting because I treat the contraction of the muscle. I think that you know what we used, the Botox, to decontract the muscle of the forehead. And in all the face, we have the same problem. We have the contraction of the muscle. Look, we have deformity of the platysma, which it could be straight for elder people, and we have a deformation of the neck back. It's the same things for the eyelid, for the eyebrow, for the nose. People say that your nose is longer when you are old. It's false, it's wrong, because it's only the muscle which pull the alar area to make the nose longer. It's the same thing for operation of the jaw. It's a contraction of the muscle. For the facelift, for me, like a surgeon, I avoid the skin surgery because I know that a long time ago, when you divide, you cut the vessel between the muscle, the platysma, and the skin, you have an alteration of the skin. That's the reason why you have to keep together the muscle and the skin. And it is one of the advantage of the thread lift because you can pull everything stronger and smoothly. For me, for the mid-face surgery is mandatory. We can use also the thread. It's not the format today, but we can use fat grafting sometime or with the thread is sometime you have some indication with to pull this part like this without surgery, with only the threads. The next surgery is very important. You have a contraction of the muscle, I will say, and I have to speak about the scar. Because today, before me, medicine practice, speak about without scar. I think that it's possible in some cases, but in many cases we have a lot of skin when you pull a lot the face, especially for elder people. And all the time I avoid the scar behind the ear. I think now with the vertical lift, you can avoid the scar behind the ear. And of course, before, a lot of people, a lot of surgeons use the scare to cut the muscle. And now, with the new procedure, you can avoid to use the scare. It's a pleasure to see the drawing with the thread. To resume it, we have to use a short scare, vertical procedure, minimal dissection, and we have to know when we are plastic surgeon, it's very easy to realize a SMAS surgery because you open the muscle and you pass through underneath the muscle, and you can insert after the thread and pull all behind or in the vertical way to fix it.